I would define countertransference as those reactions that we have to patients that are based primarily in our own unresolved or partially resolved conflicts as a result of our own developmental histories, our own idiosyncratic reactions to patients that perhaps aren't widely shared by other therapists, that somehow there's some recognition that the work that we do with patients, and I think in particular with patients with personality disorders, inevitably is going to stir up some of our own issues, and all therapists have these reactions. It's not a function of being a trainee. There's no point in our careers where we become immune to these kinds of reactions. So the point is to understand that these reactions are going to be triggered within us, that they can get in the way of our work if we don't understand them, and that it's really important to try and pay attention not just to the client, but understanding what's going on internally and between the client and myself in the moment, which is a tall order. But in terms of countertransference, what am I feeling? What am I thinking? What's my body experiencing, sensing? And what am I actually doing with this client that raises some suspicion for me that perhaps my own issues are at play here? And can I use my understanding of my own, especially internal reactions, to facilitate the work? So, for example, if the client is provoking some sort of rage in me or anxiety in me, is this what might be called objective countertransference, where the reaction is typical and might be shared by one of my classmates who would be seeing the same client or the same type of patient, or is this reaction somehow a reflection on me because of my own developmental history? There's some way in which what the client is talking about, what the client is doing, what the client looks like reminds me of someone, including possibly myself, that causes me to react rather than respond. And in particular, if I find that I'm behaving or thinking or feeling in a way that's atypical for me, I don't usually react this way to clients, and I don't usually react this way to this client in my work with them, then there's real grist for the therapeutic mill here. How can I try and reflect on those reactions in the moment, if possible, so that I don't act out defensively? And how do I reflect after the session on my reactions, either in supervision or with a classmate or on my own, in a way that my understanding might shed some light on the patient dynamics, on the relationship, and even on the course of treatment?